Alright guys, in the last video we left off with some basic functional anatomy, hopefully revision, of the knee joint. Now I'm going to get into some of the specifics related to ACL injury. Now, one of the important things to note about ACL injury is that the majority of them actually occur through non-contact mechanisms. Now, what I mean by non-contact, I mean that it doesn't involve direct contact with another player. So for example, if another player came and tackled you, and in tackling you, they kicked you in the knee and then you tore your ACL, that would be a contact injury. The vast majority of ACL injuries actually occur through non-contact mechanisms, often when the athlete is doing something like sidestep cutting or single leg landings. Now, if you think about most common sports, they tend to involve a lot of sidestep cutting and a lot of single leg landings. And for that reason, we tend to observe a relatively high incidence of ACL injury in sports like netball and basketball and soccer and American football and Australian rules football and rugby, and pretty much any field-based sport would tend to involve a lot of these sort of tasks. Even some indoor sports as well would involve a lot of sidestep cutting and single leg landing. So any sort of sport that involves those tasks tends to have a relatively high incidence of ACL injury. Now, one thing to recognize is that obviously majority of the time when people perform sidestep cuts and single leg landings, they don't tear their ACL. So to understand the mechanism of injury, we need to recognize what happens when the ACL gets torn compared to all the times that we sidestep cut and land without tearing our ACL. So the way I'm going to break into this is to first focus on some real world evidence. And this real world evidence is actually published in the scientific literature. But they use a technique called video analysis, which is exactly what it sounds like. So if you imagine, especially high level sport, generally speaking, it's always being filmed. And it's not just being filmed, it's filmed at a relatively high quality, because that's obviously part of the value of sport, is the spectator sort of sport. Now, the good thing is, because you have these cameras that are of high quality and often at multiple angles, when someone ends up tearing their ACL, we actually have some pretty good data where we can look at them and understand the mechanisms quite well. And some authors have actually gone about doing this in a very systematic way and published a bunch of different studies where they've looked at the mechanisms of ACL injury. Now, there's too many studies to mention here in this particular slide, but what I'm going to talk about is some of the key findings that are relatively consistent across all of those studies. Now, the first thing that we tend to notice is that the majority of injuries tend to occur with single leg contact. That's not to say that people don't tear their ACL when they land with both legs, but usually it's just one leg that's in contact with the ground. And when the foot's in contact with the ground, obviously the foot is generally fixed, so they're generally sort of a closed chain mechanism of injury. We tend to observe knee valgus, which I've alluded to in the previous video. Obviously, the diagram on the right-hand side, we can see well, not diagram, it's a picture. We can see a pretty extreme example of knee valgus occurring. We also tend to observe knee rotation, but it's actually a little bit inconsistent. Sometimes we see knee internal rotation, sometimes we see knee external rotation. The knee is usually near full extension. So in simple terms, that means the knee is straight, or at least close to being straight, for the majority of ACL injuries that we tend to observe. We also tend to guess that there is an anterior shear force, and I notice I said the word guess, and there's a little asterisk next to anterior shear force. The reality is, with video analysis, you can't see an anterior shear force, or any force for that matter, nor can we actually directly measure it. So based on the posture of the athletes when they're getting injured and how they've made contact with the ground, we estimate that the knee is experiencing an anterior shear force, but obviously we can't actually see that, so just keep that in mind. It's a limitation of that particular point. And another really important finding from all of these studies is that most of the researchers that have done video analysis actually estimate that ACL rupture is occurring very, very shortly after foot contact. In most cases, within 40 milliseconds. It's pretty much when the foot hits the ground, within 40 milliseconds, the ACL has ruptured. Now, that's a really important thing to think about when you're trying to plan some sort of intervention, because chances are, if you're trying to come up with some sort of intervention where people adjust their posture after landing, well, 40 milliseconds isn't enough time. Now, one thing to notice about all those different loading mechanisms is that usually it's not just one of those mechanisms at a given time when someone tears their ACL. usually you tend to see a lot of those in combination with each other. And this is what we tend to refer to as multiplanar loading. So these are the basic take-home messages that we get from video analysis studies of injury mechanism. And this obviously has the benefit of being very real world in the sense that you're looking at actual ACL injuries. Another way that they can study injury mechanisms is with what's called cadaveric models. And a cadaver, for those who don't know or can't remember, it's basically a dead body. So you can use the leg of someone that has been deceased, and obviously these are people that have donated their bodies to science. And then you can set them up in some sort of instrumented rig like you can see on the right-hand side. So basically, the key benefit of using these cadaveric models is that it allows direct measurements. So if you look at the setup on the right-hand side, we've got a leg that's set up on a sort of fixture where there's actually load cells implemented at the knee. And what that allows us to do is to directly measure the forces that are going through the knee. In addition, if you look at the very top, there's a weight stack. And basically what they do is they can simulate landing by dropping the weight stack onto the foot, and that mimics the foot hitting the ground when you're doing some sort of landing related mechanism. And obviously this is a simulation of the external loads that the leg would experience during landing, but they can also simulate internal loads. So another thing that they tend to do, and you can sort of notice this if you look towards the bottom of the diagram, they actually tend to attach cables to the attachment sites of certain muscles like the quadriceps and the hamstrings, and they can actually put force through those cables to simulate a more realistic scenario where the muscles would actually be contracting and producing force. Now, like with the video analysis area, there's quite a few studies in this field, so I'll just sort of summarize some of the key findings. So these cadaver models actually support the multiplanar loading mechanism that I mentioned in the previous slide quite well. They also tend to support the valgus collapse mechanism that I mentioned in the previous slide, so it lends itself to that idea as well. Now, some other really important findings from these studies is that they've actually been able to find that if you increase the hamstring muscle force, that tends to reduce the amount of loading on the ACL. And if you increase the amount of quadriceps muscle force, that actually tends to increase the ACL loading. Now, I'll explain the mechanism of this later on in this video series, but for now, just appreciate that that's one of those key findings that we've been able to take from these cadaveric models. Now, obviously, when I've talked about injury mechanics, I've really talked about that video analysis and then also the cadaver studies. The video analysis had a clear benefit of being, having a lot of real world relevance because obviously these are actual ACL injuries. There are some downsides though. We're really just estimating quantities. We're not really directly measuring them. And its quantitative accuracy can actually sometimes be pretty poor. And that's a pretty big limitation of video analysis studies. If you look at cadaver models, well, obviously its real world relevance is lacking compared to video analysis. They aren't actual ACL injuries. And you have to worry about things like how well you've simulated the injury mechanism, how well you've preserved the tissues after the particular person has been deceased. There's a lot of factors at play which can take away some of that real world relevance, but there's also a clear benefit. It allows direct measurements, and these measurements are generally very, very accurate. So what you tend to notice is that the benefits and limitations of each type of study are actually quite complementary. So if you actually find consistent findings between the two study types, that's actually a really good sign that we're on the right track. So if you look at the previous slides that I've just shown you, some of those consistent findings are related to that valgus collapse mechanism and also that multiplanar loading mechanism. So in the next video, I'm going to talk a little bit more about that multiplanar loading mechanism, how it happens in the body, and how that can actually inform some of our potential injury prevention interventions.